it's Khaki. Today I am talking about something that has been very frequently requested by numerous folks, reactive hypoglycemia after weight loss surgery. First off, let me say, recording in my backyard, and as many of you may know, we are in the midst of a 7-year cicada invasion. Hopefully, the sounds of the cicadas won't be too loud and this video will be able to be heard. What is reactive hypoglycemia? Let me first off say, if this is something you aren't experiencing currently and you've had weight loss surgery, you might still want to listen to the info because length of time for procedure actually puts you at higher risk for these symptoms to develop. Reactive hypoglycemia is just that, low blood sugar in reaction to something that you have eaten. Reactive hypoglycemia is much more common in folks who have had the gastric bypass or SATI procedure than those who have had a gastric sleeve. So what is it? When you develop reactive hypoglycemia, our changed anatomy is one of the things that causes it. Due to very small surface area of our stomach, our new formed pouch, when we eat something or drink something, it's very rapidly dumped into the intestine. That's why this is often referred to as late dumping syndrome. More on that later. When we eat something or drink something with simple carbohydrates and it hits that intestine very quickly, our body reacts by producing insulin to bring down our blood sugar because we have a spike in blood sugar in reaction to those foods and drinks. Our body also activates GLP-1, which also assists in bringing things down. The problem comes in when we dump that food into the intestine, the blood sugar spikes rapidly. Our body, in a effort to continue and to return homeostasis, which is a balance, throws out that insulin and GLP-1, slams your glucose down. And if any of you have ever experienced this, you know what I mean by slam. Common symptoms of reactive hypoglycemia are the same as any low blood sugar: jitters, tremors, dizziness, nausea, sweating, tachycardia. This tends to happen within about 90 to 180 minutes after you consume the cause. Now, that varies from person to person, but that is the average. I know in myself, I tend to get tachycardic, which means fast heart rate, a little dizzy, and sweaty. That's what happens to me when I get reactive hypoglycemia. Mine tends to happen in that 90-minute to 2-hour time frame as well. That's why it's called late dumping syndrome. So, what are the risk factors for developing this reactive hypoglycemia? RNY surgery, gastric bypass, or SATI. That's your risk factor. As I said, gastric sleeve, it's not as common in. The length of time since you've had the procedure is a risk factor as well. Believe it or not, the longer you get out, actually, the more common this gets. Another big risk factor, which I think will surprise a lot of people, is not being diabetic before surgery. You would think that being diabetic before surgery or after surgery, which is less common, would put you at risk for this, but it's not. It's those of us who are not diabetic are at greater risk of this. How common is it? It's, hard to really get a straight answer on that. Estimates vary from 25% to 75% of people who have had one of those surgeries will experience something like this at some point in time. That doesn't mean all the time or frequently, but 25 to 75% will experience something like this. So, what can we do to prevent it? Well, I found some really helpful tips from a nutritionist on or dietitian on how to prevent this. The number one treatment for reactive hypoglycemia is dietary changes. Control portions of carbohydrates. She recommends no more than 30 grams total, not active or trying to think of what net is what a lot of people use when they take the amount of carbohydrates, take the fiber off. But she recommends no more than 30 grams of carbohydrate per meal. She also recommends choosing low glycemic foods, things that tend not to cause a spike in your blood sugar. Low glycemic foods are your in carbohydrates, which is referring to carbohydrates here, are your berries, nuts, your complex carbs like your sprouted grain bread. Those things tend to not cause a spike in blood sugar. Also, she also says, which makes sense, avoid high glycemic foods, your simple carbohydrates, your sugars, your very high sugar fruits, your white breads, cakes, candies, avoid those. She advises to make sure that you get a heart healthy fat in with every eating experience. Heart healthy fats are things like nut butters, especially almond butter, almond oil or avocado oil or olive oil are considered heart healthy fats. She recommends 15 grams per meal. She also recommends optimizing your protein intake. Make sure that you have an adequate amount of protein at every eating event. Spacing meals and snacks apart 3 to 4 hours. If you go too long without eating and then you eat, that does put you at a higher risk of having a reactive hypoglycemic event or eating too frequently when you've still got food in your pouch from the last eating event. Avoid consuming liquids with meals. This is something, especially those of us who have had gastric bypass, it does cause food to flush out of your pouch more quickly, which can make it hit the small intestine more quickly, therefore making your glucose spike more quickly. Avoiding alcohol. That's a big one for me. I can, as I've talked about previously, I will drink no more than one alcoholic drink. Occasionally, I have tried two, but I almost always have reactive hypoglycemia if I do. I do not drink anything sweet. No margaritas, no pina coladas, no sweet wines or anything like that. So avoiding that because that does put you at high risk. Another thing that I thought was really interesting was avoiding caffeine. She said this did not cause reactive hypoglycemia in many people, but in a very distinct subset, caffeine can cause insulin uh, release, which can cause that low blood sugar. So she said, do it if you're struggling with reactive hypoglycemia. She advises doing a few days without caffeine, see if that helps. And then, big one for everything, maintain your post bariatric vitamin and mineral regimen. That's a biggie for all aspects of health after bariatric surgery. So, another thing that I read that I thought was really interesting as far as treatment. I actually, in my practice, I have a few patients that do have reactive hypoglycemia. And the gold standard of treatment for this is number one, dietary changes. I am a big believer in wearing a continuous glucose monitor if you have reactive hypoglycemia, even for a short period of time. I wear, if you can see it, a Freestyle Libre. Tiny little thing. It syncs to my phone. It gives me a heads up if my glucose starts to drop. I also, if I eat things, I can go back and see what my blood sugar did. So it gives me an awareness of what things tend to cause a glucose spike in me and therefore a reactive hypoglycemic event. Just wearing that has decreased my incidence of reactive hypoglycemia to very, very infrequent. If you do have reactive hypoglycemia, I will say something that I found in my practice. Insurance typically will not cover a continuous glucose monitor like a Libre due to that diagnosis. But if your insurance does not cover it, there is a cash pay program that is $70 a month. That is for two of the readers, like I have on. You change them every 2 weeks. Sometimes just wearing a month, just using these meters for a month to look at how you react to certain foods is very empowering and gives you the tools that you need. So it's not necessarily something you have to do forever. Now, going back to medications for reactive hypoglycemia, the gold standard, truly the only FDA approved medication indicated for reactive hypoglycemia is a medication called acarbose. This delays the insulin or the glucose absorption or the glucose spike of foods. So this helps to prevent that spike in glucose, which ends up causing that hypoglycemic event. Downside of acarbose, you have to take it 3 times a day. So I would highly recommend dietary changes first, but that is always a possibility. It's a relatively inexpensive medication. It's a generic. Even without insurance, I did some checking. It's about $20 a month with a discount card. So it's affordable for most people. I think that I have seen very good response to it. I think I have about 2 patients that currently take it for reactive hypoglycemia. That dietary changes didn't do enough for them. So they have gotten pretty much complete control of their symptoms with acarbose unless they eat something that they really probably shouldn't, like birthday cake, or drink a sweet alcoholic beverage. Another medication which some people use for reactive hypoglycemia are GLP-1 injections. Now, GLP-1s are wonderful. I use them in my practice a lot for diabetes and for weight loss in patients who are lucky enough to get them covered. They are not covered with a diagnosis of hypoglycemia, and they're very hard to find. There is a nationwide shortage on GLP-1s. Without insurance coverage, you're looking at $1,300 to $1,400 a month. So it's just not doable for most people without insurance. And like I said, finding them is the problem, really. So my experience with reactive hypoglycemia, I have found we all have different triggers. My triggers tend to be alcohol. Alcohol in conjunction with carbohydrates almost always does it for me. And not simple carbohydrates, because I don't eat white bread, I don't eat sugars, I don't eat sweets unless they are bariatric friendly. So I have found if I do something like drink a beer, which I very rarely do, if I drink a beer which has carbohydrates in it, and then I have something like a very small amount of a sweet potato, I'm going to have reactive hypoglycemia. Or if I go out to eat and have a glass of wine and the sauce that comes on my food maybe has a little bit of hidden sugar in it, I'm probably going to have some reactive hypoglycemia. But as I said previously, making changes has really enabled me to get it under control. I hope that you have found this information helpful. My biggest piece of advice, reach out to your team, especially your dietitian. They are experts in dealing with prevention of things like this. So reach out to them. If you've become disconnected from your team, or if you had surgery in Mexico, for example, where contact with a dietitian is not included, you can find private dietitians who do visits via Zoom and specialize in bariatrics. If you would like some info about some of those, I can provide that to you. Just ask in the comments below. I would love to hear your experiences. Have you ever had reactive hypoglycemia? What have you found to be the triggers for it? Also, I would love to hear any suggestions for future videos. I hope everybody has a great week, and we will see you next Wednesday. Bye.